Time is running out. Tomorrow is the deadline for you to sign up for health care coverage through the Affordable Care Act. So we have experts to help you navigate that process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services. And Laura Packard is with Get America Covered. Now, they're all here to answer your questions, and here's how it works. All you have to do is text us your question. The number is 336-379-5775. Remember, this is a text only. Please don't call, but we can answer all kinds of questions when it comes to healthcare and healthcare coverage, as well as Medicare as well. All right, first and foremost, Laura, let's start with tomorrow's deadline. What do folks need to know about the deadline, when it all starts, and all that jazz?
Okay, if you don't have health insurance right now, you should go to healthcare.gov before midnight tomorrow, January 15th, to enroll. And this is the deadline for the open enrollment period, the standard one for everybody. If you have life changes such as having a baby, getting married or divorced, or moving to a different county, you may be eligible to get insurance later if you lose your insurance through your job. But for most people, tomorrow is the deadline. So go to healthcare.gov and sign up today.
Okay, so that is what you need to do. Now, if you're thinking to yourself, I'll just let whatever I had last year be what I'm going to have this year, or I'm just going to pick the first thing that's on the list. Morgan, let's talk about that, because I know that there are a lot of plans that are decently inexpensive, like maybe $10 a month for the premium, and they all have different coverage points.
They all do have different coverage points, and also let's talk about the network. If you are a Novant person and you might have been automatically enrolled in a plan that just uses Atrium Wake Forest Baptist, that's going to require you to give up your Novant positions. So you have to check that network. Also, you need to look at the drug coverages that are built in, because there's been some changes as far as there were copays. Some plans do have copays. Other plans now will have a co-insurance split. So you might have a drug that you were used to paying $40 for, and now you might actually pay $80 for. So check your formulary, check your network and your doctors.
Right, because just because your doctor was in your network last year does not mean that your doctor is going to be in your network this year in that same plan. So you have to do all of the checking. Okay, so we've got ACA, we've got healthcare enrollment. That is tomorrow. Now let's talk a little bit about Medicare, Catherine, because while the main yearly enrollment is over, anyone who is of a certain age has a certain timeline to sign on for Medicare. So let's go through that.
Sure. So if you are approaching your 65th birthday 3 months before the month of your birthday or 3 months after, you need to sign up for Medicare. Whether or not you are working, you need to check in and either indicate and sign up for Medicare, or indicate that you have coverage through your employer that meets Medicare standards. The important thing about that too is you need to look at enrolling in Part B Medicare, because if you miss that window and decide later that you want that coverage, you will pay a penalty, not just for 1 year, but continuously for every year that you missed.
Okay, so 65, that is the magic age.
Number.
And whether you are still working or not, you still have to sign up for Medicare, and then you can defer things, but you must sign up, otherwise you will pay a penalty. Do not miss that, folks, because that is a problem, and that is something that we want to talk about. All right, the other thing we want to talk about also is the home tests. So the COVID at-home tests, they're going to be covered by the government starting tomorrow. So Morgan, what do we need to know about that?
So starting tomorrow, if you go to your local pharmacy and you are able to purchase a rapid test, please keep your receipt. I would also tell you, keep the box. We do not have clear clarification right now as to exactly how that reimbursement process is going to work. So you will have to manually file that reimbursement with your health insurance company.
Yeah, I know the best case scenario is that the administration was trying to push companies to partner up with like a CVS or whatever so that you could just go there if you had that insurance and just get your at-home test and not have to worry about paying for it up front. But that is not the case at the moment, as we're seeing that that's how it's working out. Is that correct?
That's correct. At the moment, what we do know for a fact is that you are allowed 8 tests per month for every person that's in your household that's on your insurance plan. And we do know that as of tomorrow, it will be set up as a reimbursement feature. So you will have to file that claim yourself.
Okay, keep that receipt, people, and keep the box. All right, we are just starting our Q&A of healthcare open enrollment and Medicare as well. Make sure you get your text questions in. We're going to take a quick break. We'll be right back. All right, we are back with our healthcare experts answering your questions about healthcare enrollment as well as Medicare. And so this first question is, will Medicare cover the test kits? Catherine.
So if you are receiving the original Medicare plan, in other words, not on a Medicare Advantage plan, they will cover it only when you see your physician and it is ordered by them. But you cannot petition Medicare for reimbursement if you buy at-home tests.
Okay, but if your doctor says, I want you to go buy an at-home test, and they prescribe it to you and you go to the pharmacy and you get it, then Medicare pays for it. All right, so Morgan, what happens then? Are there other Medicare plans and things that might cover it?
So if you do have original Medicare and a Medicare supplement, you would need to file your claim directly with Medicare and then the supplement as well. If you are on a Medicare Advantage plan, once again, you would have to file that claim manually yourself.
Okay, so you need to keep that receipt and all of that and be very aware of that just because it is now covered by health insurance, it is not covered by Medicare. Now, that doesn't mean that you can't get some free tests when the government has the website open, and that website, Laura, is supposed to be open by Wednesday, yes?
I think that's what we hear.
Okay. All right. So that is, and we'll just have to see if that website is up and going by that time. All right. In the meantime, we've got this question, Laura. If you're unemployed, do you qualify for any health care plan?
Well, you should go to healthcare.gov and plug in your estimated income for this year to see what you qualify for. If you lost the health insurance through your job. If you're unemployed but you still have health insurance, then you would wait until that health insurance terminates before you go to healthcare.gov. But hopefully you would qualify for a very affordable or maybe even free plan based on your income level.
Mm-hmm. Okay. All right, we have a couple of Medicare follow-up questions. This first one says, are you saying we have to sign up for Medicare even if we have an 80-20 employee retiree plan? Morgan?
Yes.
Okay, and Catherine, yes. Yes, yes, yes. You must sign up. When you are 65, you must sign up for Medicare. Now, that doesn't mean that you'll actually use that Medicare coverage, but you must sign up for that Medicare coverage. We're all nodding our heads. Yes, that is correct. All right, while we're on that, we have somebody asking, what are the different Medicare plans? So let's take a look. We've got a whole list of the Medicare plans so that you can see what they are. And this is kind of an abbreviated list because there's a whole bunch out there. But we're going to take a look at Part A, B, and D, and Medigap. So can you just kind of go through the list of what those things are? Catherine?
So Part A is what you and I would think of as our hospitalization. That is, if you get sick, go into the hospital. You've paid for that as you've been paying for your taxes over the years, so we're not billed more for that. Part B is your outpatient services, your doctor's office visits, your labs, physical therapy, those types of things. Part D is your pharmacy benefits. So that is the supplement or the payment that you get for your drugs, and you have to sign up for that separately. And then there is something called Part C, and Part C is what we were talking about a few minutes ago, and that's Medicare Advantage or a managed Medicare plan. So think of it as an HMO for people that are over the age of 65 or on Medicare.
Okay, and so there's another follow-up text question. It says, how long will we have to pay the late penalties? And it's for the rest of your life. So for the
Yes.
rest of your life, you will be paying a late penalty. So you don't want to do that. Morgan, I think a lot of times people think, okay, but I was told that I don't need Medicare right now because I have insurance. What should they do? Should they call an insurance person and just walk through the steps?
Yes, absolutely. And if you don't want to call an insurance person, call Social Security and they can help walk you through the steps as well.
Yeah, and you know, there's also several different resources. You like SHIP, correct, Catherine?
Absolutely. SHIP is a wonderful program that the North Carolina provides free of charge for people, and they are volunteer staff, and they can answer just about any question you can throw at them.
Okay, and we'll have that resource in our web story. All right, Laura, this person says, do you have to cancel your insurance if you don't want it to renew?
Yes, I would hope that you are canceling one policy because you've received insurance through your employer, that you're not going without insurance. But yes, if you've been auto renewed, which if you had a policy last year, it probably auto renewed at the end of the year, and you should have gotten something in the mail to that effect. So if you received that, then yes, you will need to call and cancel, and they may even they should refund your January premium if you canceled as of January 1st with new coverage.
Okay, but your big point is don't go without health insurance because there are so many plans out there that there is probably one that suits you just fine.
Absolutely.
Okay, all right, we're going to continue to take your text questions. We're going to be back in just a few moments. All right, we are back with you answering your health and Medicare related questions. We have Catherine Sevier from AARP, Morgan Campbell from Alliance Insurance Services, and Laura Packard from Get America Covered. All right, Laura, so these folks are asking about Medicare and about North Carolina. What would you tell them about that whole Medicare expansion?
Well, if you are low income and you don't have health insurance, you should contact your state legislators because they are back in session right now, and they have the opportunity to expand health care to hundreds of thousands of North Carolinians using federal money. So it wouldn't cost them anything. It wouldn't cost the state anything, and it would get you health care for free. So call your state senator, call your state representative, and tell them to take care of health care for North Carolinians.
All right, on the Medicare beat there, Catherine, what is the difference? You said that you believe that sometimes people get confused about Social Security and Medicare sign up?
Absolutely. Used to be that Medicare and Social Security sign up were both at age 65 for full benefits. And now what we're seeing is that many of us have to wait longer than 65 to get fully benefited for Social Security. Right now it's close to 67. Don't confuse the two sign-up dates. Medicare is still 65, and the penalty goes into effect if you don't sign up in that 3 months before, the month of your birthday, or 3 months afterwards.
Right, and there's all kinds of resources and tools. AARP has a great resource online that you can do that. You can call an insurance professional. You can ask them questions. It is not going to cost you anything to ask questions and find out what you need so that you don't have to have that penalty. Okay, this person is asking, how do I sign up for Medicare? Morgan?
So you can actually sign up on Social Security's website, or you can give them a call and sign up by phone. It's very easy to do.
All right, this person's saying, is there help for medication if you can't afford your meds? And I'm wondering if they mean for ACA healthcare.
Well, there may be help locally. You should see whether your medical provider has sample medications for you. You should also talk to the provider of your meds and see if they have plans available for people that can't afford their prescriptions. And contact your legislators. They have the chance to lower prescription drug prices if they vote on it.
It's a good point about going right to the company, because you see a lot of companies' websites for whatever brand name drug that you have, and they will say if you need help, and then you can kind of put in the parameters so that that can happen. Thank you all for answering our questions, many questions on Medicare and ACA. Want to remind you about the deadline. The deadline for signing up for health care through the Affordable Care Act program is tomorrow. Let's put up that calendar so that everybody can see it. Be reinforced with that. It is tomorrow, and your health care coverage starts February 1st. If you don't sign up now and don't have any major things happening in your life, you will be without health insurance for this next year.